Muscle. I'm Paul Maverick.
I'm Lala Hensley.
And today we are working out on the Modular Assist Dip Chin Machine, which is a really complicated name and what looks like a medieval torture device, but actually is quite simple. And I think the healthcare debate is a little bit like that. It seems all complex. There are certain elements that once you make them clear, really help our understanding. And I think one of those elements came out of a study released by the Harvard Medical School that just came out this past week. Lala?
Actually, they said that originally it was 18,000 people who died per year for lack of health care, but now they redid the study and they found out that it was 45,000 Americans every single year are dying because of lack of health care.
Well, that works out to like one every
12 minutes.
Every 12
minutes someone's dying because they don't have health care.
So let's say you're
There's
at the
got to
gym.
be people that they're not considering, of course.
So you're at the gym for an hour. 5 Americans have died during that time, during your workout, because they don't have health insurance. They used figures from the Center for Disease Control. They had amassed these statistics, and the Harvard team analyzed them and discovered that the number of Americans dying from lack of health coverage is 2.5 times larger than they thought it was. Now, when I imagine 45,000 people a year dying from a lack of health coverage, that seems to me like, what doesn't seem, it is. It's more than die from homicides and drunk driving put together.
Because now they're also saying that you have to have insurance, and if you don't have insurance, they're going to charge you about $3,800. What is it, per year or per month?
It's per year. Now, this is the Baucus plan. Now, it's important to understand that there are 5 committees in Congress that have been working on these healthcare plans, and the last one to report was the Baucus Senate Finance Committee, and these are details from the Senate Finance report.
Well, they said that you have to have insurance. It's all privately owned, and of course, this is all very beneficial to the insurance companies. So you have to have insurance, and if not, you get fined up to $3,800 a year, which is absolutely ridiculous because there's residuals, there's, you know, how are people going to afford to pay for their prescriptions?
Yeah, I mean, imagine, low-income people are supposed to be subsidized up to a point, but let's say middle-income families.
Oh yeah, absolutely not. They're trying to pay for their kids going to college, they're trying to pay for food on the table, and people can't even afford college now as it is, and
this is just going to make it worse. And if you can't pay, you get fined. The Baucus plan does not include the public option, which is key. Now, public option means anyone who wants to, Lala or myself or anybody, could have the choice of enrolling in a government-sponsored insurance plan, sort of like Medicare. Now, in fact, that study said that people who are uninsured have a 40% higher chance of dying than those who are insured. But they only counted people up to 64. Because above the age of 64, everybody's on Medicare. So that problem is solved. It's something that's not really part of the debate is think of how many people in Canada die every year because they don't have health insurance. How many? Estimate that. What do you think?
Zero.
How many people in Denmark?
Zero.
How many people in Sweden?
I believe it's zero.
France?
Zero.
Yeah, zero. 0 people die in those countries for lack of health insurance. But again, in our country, like we said, it's like a constant mass casualty event because we have so many uninsured people. We have 47 or 48 million who are uninsured. Dr. Steffi Wohlhandler was one of the authors of the study. She suggested that what we need is not the public option, that's too timid, that doesn't go far enough. And what would really be better would be if we had a single-payer universal healthcare plan like they have in France, like they have in Canada.
The problem is right now we're so in debt, how are we going to afford that? You can't, you know, where does that money come from?
Well, you think about the administrative costs that you would save by having a universal healthcare plan. You would save 300, if I have this right, 300 to 400 billion, with a B, dollars every year, because private insurers have enormously high overhead. They pay advertising costs, they pay for all these administrators, they pay for CEOs, they pay dividends to their stockholders. And Medicare doesn't have those kind of expenses. So if we had Medicare for all, $300, $400 billion a year in administrative expenses would disappear. So check out callcongress.org, get the phone number for your congressperson and your senator, and give them a call and let them know what you think. Here on Political Muscle, we want to thank you for tuning in. Remember to get out there, get active, make your voice heard, and flex your political muscle.